Good afternoon, everybody. Hope you had a nice weekend. Today's a gorgeous, gorgeous day. So happy Monday. Hopefully you can get outside a little bit to enjoy the weather. I want to thank you all for continuing to tune in to these press conferences. As a reminder, starting today, these are no longer daily pressers. It will be Monday, Wednesday, and Friday, every day at 1 o'clock. Monday, Wednesday, and Friday, every day at 1 o'clock. If you would like more frequent updates, I would encourage you to go to the governor's website, governor.ri.gov, and sign up for our daily COVID emails. Thousands of people have done that. You'll get an email every day, and it'll provide you with up-to-date information. Okay, we'll begin as we always do. We'll put the data up on the screen. As you can see, more good news in the data. The numbers are continuing to trend in the right direction. Yesterday, we saw 51 new cases. I remember it wasn't that long ago, I was up here and there were 300, 400, hundreds of new cases a day. We are now testing more people, and I'm here to report only 51 new cases. So that should give you some confidence that we are continuing to have a stable situation and doing a very good job dealing with the virus. I will say, I have to report, unfortunately, an additional 10 fatalities. And Dr. Nicole Alexander-Scott will talk about what we saw over the weekend. As good of a position as we are in, let's just bear in mind that every single day, Rhode Islanders continue to lose loved ones to this virus, and so we all have to continue to be vigilant and aware and alert. Okay, I have a handful of announcements today that I'd like to get through. I'm going to begin by starting with a quick announcement related to the Crush COVID RI app, Crush COVID RI. I want to first acknowledge Shirag, who's on my team, who's here today. In case anyone has any detailed questions, he and his team have worked 7 days a week for months to make sure that we could have this app for the people of Rhode Island, so I want to thank them. I want to let you know that as of today, a new technical improvement to the Crush COVID app is available for download at the App Store and Google Play. We are calling this version 1.5. It's not quite the version 2, which will roll out in a few weeks, which will be the final version. We're calling it version 1.5. It's got some improvements to it, a little bit easier to use, on an Android phone, and the location diary, a few of changes have been made so that it is more accurate, and particularly accurate on Android devices. So I would ask you please to take a second to go today and download the new app, the updated app. I did it this morning. I think it took me 10 seconds. So download it. If you haven't yet downloaded the app, we have about 46,000 users. I'd love to get to 50,000 by the end of the week. So if you haven't yet downloaded the Crush COVID RI app, please do that, Apple Store or Google Play. If you've already downloaded it, take a second to download the new version. Version 2 of the app, which will have additional features and functionality, will be out by the end of this month, by the end of June. And that is the version that we are going to call the final product. So this isn't something that we're going to continuously update every month or every couple of months, but it is something that I'm asking everyone in Rhode Island to download, to use. It logs your symptoms. It'll allow you, if you test positive, to quickly see where you've been, and it's really an excellent thing for all of us to take advantage of. Okay, this afternoon, most of what I want to talk about relates to testing. I have some new announcements related to testing. So first, let me tell you where we are now, where we've been, and where we're going. Testing continues to be a critical piece of the puzzle as we all deal with fighting the coronavirus crisis. Earlier this morning, I was on a call with all the other governors and the White House and Dr. Birx and the CDC, and they continue to emphasize to us the importance of testing. And so I want to share with you where we are and where we're going. Here's the good news. Right now, Rhode Island is the best in the nation when it comes to testing. We are a national leader, arguably a global leader, as it relates to our testing. We have the highest rate of testing per capita of any state in America. We have now tested just above 15% of our population. For comparison for you, the national average is about 5.5%. So we're about 3 times better than the national average. For the past week or so, we've seen a percent positive rate that is below 5%. And for the past few days, we've been below 3%. Now, that's a lot of numbers, and you might be saying, what does that mean? So at a month and a half ago, when we were at the height of the crisis, our percent positive rate was well over 20%. So we were at a point where we were testing fewer people, and we had like a 25% of the people we tested were positive. Today, we're testing many more people, and less than 3% of the people we're testing are positive. Furthermore, you might recall there were some big crowds around Memorial Day, and we had been wondering, would we see a spike? And at least as of now, which is when we'd be seeing the spike, a couple of weeks after, there has not been a spike. So, this is the kind of thing we have to be constantly vigilant and constantly looking at the data, but this is all good news. This is all good news. We're testing more, testing's more available. We continue to test in communities, Central Falls, Providence, Pawtucket, Woonsocket, that are hardest hit, and we continue to see the test positive go down. Why is this happening? How did we get here? We were one of the first states to establish drive-through and walk-up testing sites, and I want to thank the National Guard for staffing those sites. We were one of the very first states to use the rapid testing machines, and we were the first state in America to partner with CVS, our local company, in order to have large-scale rapid testing. And again, thank you to CVS. We have put testing sites in communities that are hardest hit, including walk-up testing sites, out of recognition that not everybody has a car. And we are continuing to do that. We're going to continue to expand. So everything we've done from the beginning until now has been to have a high volume of testing, and to make sure everybody could have access to that testing. Now what we want to do is keep that high volume, but our emphasis is not just a lot of testing, but smarter testing. It's testing smarter, not just testing more. That's where we're going. So, what does that mean? It means testing in ways that give us information about where the virus is so that we can react to it quickly. We have a 3-part testing strategy. Part number 1 is we want to be able to rapidly test everybody who has symptoms. If you're feeling sick, if you have a fever, aches and pains, trouble breathing, etc., we want to make it so that you could be tested quickly and have your test results within a couple of days. We are doing that now. We have met that goal. We are continuing to meet that goal, and we will continue to meet that goal. That is not easy, right? As more people go back to work, kids are going back to camp, kids are playing sports, we're going to open school, more people are going to get sick, so we're going to have to keep increasing our volume. Our commitment, my commitment to you, is throughout the rest of this crisis, if you feel sick, you can get tested and have your results within a few days. That's part 1. Part 2, we need to be able to quickly react to outbreaks. We know that's how the virus works. There will be outbreaks, maybe in a nursing home, maybe in a manufacturing operation, maybe in a school when school's open. We know there will be, outbreaks. Our commitment to you is that our team can be on the site of an outbreak within 4 hours, rapidly testing everyone who may have been in contact with the person who was infected. And we continue to do that. We have continued to do that. We're doing that most particularly now in nursing homes, but we've had to do that for a few workplaces as well when there was a concern about an outbreak. Then finally, and the piece I want to talk further about today, is we want to create and expand an early warning detection system by testing key groups of asymptomatic individuals. So people who aren't sick, testing people who don't feel sick at all in groups. Now, people have said to me, why do you want to test people that aren't sick, Governor? Because let me say this, from my perspective, I never again want to have to close Rhode Island's economy. That is a priority of mine. Having lived through what we've lived through in these past few months, the number of people who are still out of work, businesses that have closed, we never want to do that again. Our goal is to open the economy once. What that means is that if we do see an outbreak in a community, in a school, in a place of worship or work, we need to be able to detect that before it gets out of hand, so that our response is to clamp down in a limited way in that location. What happened all over the country before was that the virus got out of hand. It ran away with itself, and so we had to shut everything down. Well, now we shouldn't have to do that again, because we have the testing, we have the contact tracing. People will continue to get sick, people will continue to go to the hospital, there will continue to be outbreaks. But if we do enough testing of people who don't have symptoms, we can catch it early enough and then try to put a lid on the spread. God forbid, if we have to close anything again, we'll close just a town, just a business, just an industry. So to that end, we are beginning a new aggressive effort starting today to test asymptomatic people. Now, we will say this. It is a fact that the tests are not as accurate on people who don't have symptoms as they are if you do have symptoms. That's true, but they are still somewhat accurate. And some information is better than no information. And we have had many thousands of people test positive who don't have symptoms. And every time we can find a positive person and put them into isolation, we've done a good thing and reduced the spread. So nothing we're doing is perfect, but we have to use every tool at our disposal and do everything we know how to do in order to continue to keep the virus in check. We've already begun some of this asymptomatic testing, and I've talked about it here, most particularly in nursing homes. So we now have tested or offered testing to every employee at every nursing home 3 times. Our goal is to continue to test the employees of nursing homes once every week to 2 weeks, continuously, and that has gone very well. We're doing the same in other community care settings, in the ACI, among first responders. So we have already started this. But for this early warning detection system to be effective, and that's what it is, it's an early warning system, we need it to be more robust. So I would ask if you could now put up the slide which explains what I'm talking about. So you see a slide on your screen in front of you now, which attempts to lay out where we want to go with this early warning testing system. Starting today, close contact workers will be able to schedule a free test at one of our National Guard sites. So what am I talking about? Hairstylists, barbers, people that work at nail salons, gym employees, people that work in a tanning salon or a tattoo parlor, massage, etc. If you work in one of these, what we call close contact businesses, and you don't feel sick, we're encouraging you please to go get yourself a test. It is our goal to be testing 900 people a day who are asymptomatic. We're also opening the asymptomatic free testing option to education workers, starting today with child care employees. If you fall into one of these categories and you're willing to go be tested, even if you don't feel sick, you can, as of today, you can go to portal.ri.gov, or you can call the Department of Health 222-8022 and schedule yourself a test at one of the National Guard sites. So our goal, as I said, is to be ramping up to 900 people a day. These are people who do not have symptoms, who work in these industries, so we can just get a feel for the prevalence of the disease in those industries. We want to, yes, and we're going to continue. This slide that you have in front of you will show that over time, we're going to roll this out. The next time we come back to you, we're going to be rolling it out to retail workers, manufacturing workers, when school opens up again, teachers, students, parents, higher education, URI, CCRI, and RIC, when the students come back. So today we're starting with education workers and close in contact workers. And I would just encourage you, if you work in one of those industries, you don't feel sick, it's free, it's easy. You can schedule it yourself at portal.ri.gov. Go ahead and get yourself tested. It'll just give us data to know what's going on in those businesses. I would say this. I've talked to a lot of business owners, barbers, nail salons, et cetera, restaurants. And you know what they're saying to me is, Governor, people are afraid to come back. And I think that's natural. You know, it's going to take time. Everybody's going to come out at their own pace, and that's appropriate. But if you are a business owner, it's probably in your interest to encourage your employees or yourself to go ahead and get tested, because it'll allow Rhode Islanders to have confidence. If we test a couple thousand hairdressers and the test positive rate is extremely low, then that's a good thing to know. You know, these are all things that we're doing to contain the virus, but frankly to get confidence back among the people of Rhode Island that it's safe to go to church, safe to get your hair done, safe to go out to dinner, safe to go back to the office. So the last thing I'll say is throughout, and this is on the slide, throughout all of this testing, we're going to continue to emphasize additional testing in communities of color and in high density communities such as Central Falls, Pawtucket, Woonsocket, North Providence, areas of Providence. This is what we really have to keep our eye on. And so, you know, that's a lens that will cut across everything that we do. The CDC, this morning I was on a call with Dr. Birx. We have done all of this in consultation with the CDC. This is what is being recommended to us as best practices for early warning testing protocols as we go forward. So I'm happy to answer questions on that. It's a lot of information. It also took an enormous amount of work, and I want to thank everybody who enabled this to happen. Okay, a couple of other things that I want to mention. Obviously, over the past couple of weeks, we have had large protests, people gathering mostly peacefully in very large gatherings, exercising their First Amendment rights. I feel very proud of the people of Rhode Island as I stand here this morning. In the past, probably 10 days, week to 10 days, we have had nearly 20,000 Rhode Islanders across more than a dozen different protests in communities and towns coming out to peacefully exercise their First Amendment rights. I want to first thank every community, the community leaders who organized these dozen or so protests. These are never easy to plan. You worked extra hard to make sure that they were planned and that they were peaceful. So I want to thank you for that. On Friday night alone, they estimate over 10,000 people came out to Providence to demand change. And it was by and large, a peaceful event. So to all of you who came to protest in peace, to the organizers who were urging action and anti-violence, I want to say thank you. And to the many, many members of law enforcement and the National Guard who exercised discipline and restraint and professionalism, I would like to thank you for keeping us all safe and for keeping it peaceful. As some of you know, I did not go to the protest, although I said I supported. I was reluctant to participate in something that clearly violated the social distancing rules. I did go out late in the night when things were getting particularly heated. I went out and I spoke with the protesters. I did that because it was clear to me that there were people there who felt they still hadn't been heard. And so I went out to make it clear that I am listening, I am committed to action. And frankly, I went out to de-escalate what was a very tense situation. The night ended peacefully. And so again, I can't thank you enough for participating in that. I also am proud of the nearly 100 employees from my administration who volunteered Friday at the protest. We were there handing out masks. We handed out thousands of masks, distributing information about COVID-19. I will say most people at the protest, they were there for hours, but they were trying to follow the rules, using hand sanitizer, staying with the groups they came with, wearing masks. So I want to thank all of them. I would say this, a few things. If you were there and I know there were a lot of young people there, which is great. It's always interesting and hopeful to see you come out and take a stand. For the young who were there, my daughter was there, some of her friends. Please take extra caution not to be around older people or sick people or people with underlying health conditions that may be in your house over the next couple of weeks. We are also encouraging anyone who was at one of the dozen protests to go ahead and get tested. Again, you can go to portal.ri.gov to schedule a test. My husband and daughter and I are going to get tested later this week. Dr. Nicole Alexander-Scott and members of her team who were there passing out literature. We are all going to get tested this week. And of course, if we test positive, we'll go into isolation. So I would say if you were there and if you have folks in your family who are sick or older or vulnerable, please exercise extra caution. And if you were there, even if you're not feeling sick, we now have this new way that you can just schedule a test, portal.ri.gov, schedule yourself a test. We know that the tests are most effective between 3 and 7 days after you were exposed. So maybe today, tomorrow, Wednesday, Thursday, go online, schedule yourself a test. It's better to be safe than sorry. So with that, I will turn it over to Dr. Nicole Alexander-Scott and then come back to answer questions.
Thank you, Governor. Good afternoon, everyone. Thank you for joining us. As you can see, with how great a job the governor did outlining the updates. This continues to be the place to be to get the latest information that we want to continue to provide for you. In terms of the data, as the governor said, we are trending in the right direction. We have 51 new cases to announce today. This number is relatively low, and our numbers from over the weekend were also relatively low. 97 new positive cases were confirmed on Saturday, and 65 new positive cases were confirmed on Sunday. There are currently 146 people with COVID-19 in the hospital. Of these 146 people, 28 are in the intensive care unit and 20 are on a ventilator across Rhode Island. Again, the trends in this area are good news. Since our last data update on Friday, we sadly saw an increase of 27 COVID-19 associated fatalities in total. There were 10 new COVID-19 associated fatalities confirmed today, and the numbers for Saturday and Sunday, respectively, were 10 and 7. Generally, the age distribution for these people was consistent with what we have seen throughout the crisis. Of the 27 people that we've sadly lost, 2 people were in their 60s, 7 people were in their 70s, 9 people were in their 80s, 8 people in their 90s, and 1 person was older than 100 years old. Our sympathies and our prayers are certainly with the families of these Rhode Islanders. The governor also did an excellent job outlining our overall comprehensive testing strategy for Rhode Island that fits into our scheme of testing: 1, all symptomatic people; 2, doing rapid outbreak response testing quickly and effectively; and 3, as was shared today, having a targeted, effective early warning detection system, which includes testing certain people who are asymptomatic. When we've talked about testing in the past, we have said consistently that results are more accurate for people with symptoms. That is still true. That has not changed. However, testing people without symptoms can have benefits along the lines of what the governor shared when used in targeted ways, as we are doing here within a larger strategy. We're sampling specific members of the population so that we can better understand the spread of illness and determine how to most effectively inform our symptomatics testing and rapid outbreak response testing. All of this supports our approach of testing smarter as we go forward. The best example of what we have done thus far with our early warning detection system is testing asymptomatic people who live in congregate care settings. That's been the first example. What the governor shared today is now expanding to testing within child care workers, people who work in gyms and fitness centers, workers from personal service fields, and being able to really understand the landscape among those workers who are high contact workers. We recognize that this is just a sampling of the different types of workers throughout the state, and that's really what we want to start with so that we can understand the spread of disease among this population. We envision making additional announcements in the future about the people in the fields that we are focusing on. As mentioned, there will be no charge associated with testing, and people will be tested regardless of their immigration status and regardless of whether they have health insurance. As stated, you can either go to portal.ri.gov or you can navigate there from our RIDOH COVID webpage at health.ri.gov/COVID. And of course, particularly for those that may not have internet access, you can call 401-222-8022 as an option if people need it. also available in multiple languages. Once on the portal or you call, you will get asked for some basic information, and you will be able to schedule a test at our current testing sites, Rhode Island College or at CCRI. Over time, we'll continue to ensure that we can reach the people that we are focusing on for this specific early warning detection system of testing. You will also get instructions on how you and your healthcare provider can get electronic access to your results, usually in about 3 to 5 days. So we will continue to keep you informed as we learn of the information. Again, this is a sampling of the workers who are engaged in high contact engagement so that we can help ensure an understanding of the spread of illness here in Rhode Island. The governor also referenced another example that we are incorporating into this. People who may be at higher risk because they attended one of the demonstrations that has happened over the last several days. We are recommending testing for people who have gone to a large demonstration over the last few days. This aligns with what Dr. Redfield, who runs the Center for Disease Control and Prevention, has also recommended. People who went to a demonstration can schedule a test in the same way that was described earlier by going to the scheduling portal at portal.ri.gov. And we also want people who attended one of the events to make sure that you continue to monitor for symptoms carefully. So whether or not you have symptoms, the testing is available, but particularly if any question of symptoms develop, please make sure that you access the opportunity to get tested. And then also, as mentioned, please continue to be thoughtful about who you contact, particularly if there is someone who is at higher risk over the next 2 weeks. Try to minimize contact with people in your life, such as older adults and people with underlying medical conditions that fulfill the category of being at higher risk. At the very least, you should think about avoiding embraces like handshakes and hugs with those particular people, and avoid sharing food or drinks with anyone. These are ways to continue to support each other as voices are being raised. I also want to thank all the people who came out to make their voices heard peacefully, and want to thank all the public safety professionals who did an amazing job supporting as well. We had Rhode Island Department of Health staff at all 3 events on Friday and Saturday, providing resources and support, including distributing 5,000 masks, hand sanitizers, and information about testing. We're thankful to all of the partners who joined with us to help support as well. It also gave the opportunity to stand in solidarity because, as we have mentioned, health equity is a principal focus for the governor's entire administration, as well as at the Rhode Island Department of Health. We say often that everyone should have an equal opportunity to be healthy, and that's not just talking about the absence of disease. It's also talking about the presence of physical and social well-being and well-being at the community level. Structural racism, for example, is a public health issue because it affects health outcomes at the individual level and at the community level. When structural racism manifests as police violence, as it did in Minnesota, or it manifests as inequities in housing or education or environmental exposures, or challenges with accessing good jobs with fair pay, the health of people and the health of communities can suffer. And what we are seeing now is people responding to injustices in these areas and other areas that have spanned generations. This is certainly a very complicated moment with both COVID-19 and racial justice issues, being front and center simultaneously, but we had the opportunity from a public health perspective to stand with the peaceful protesters, helping to make sure that they were safe from a COVID-19 standpoint. The majority of people that we saw were wearing masks, and we made sure that they had information available to them, as well as the testing that's available to them. And we also supported what protesters were saying, in that all people and all families deserve to be safe and healthy, and that Black Lives Matter. From a public health perspective, it's imperative that people continue to be engaged. That means being involved in your community, that means voting, and that means standing up and calling out injustice when you see it. As we've been saying over the last week, we all have farther to go. That includes people like me in leadership positions. The way forward from here is making sure that we listen to people in communities that are disproportionately impacted, making sure that we listen to each other, and then coming together and acting as one community and one state, doing what we need to keep each other safe as well. So with that, we will get started with questions.
So Governor, on the mask issue, by not wearing a mask the other night, although you've apologized, by not wearing a mask, by asking demonstrators to hold hands with such a large group, as worthy as the cause was, and though most of them were wearing masks, what do you say to people who are watching at home, growing increasingly frustrated at certain things they can't do? They've heard you say these are the rules for the past few months, and now may think most of those have gone out the window, and now may be thinking, to heck with it, I'm done.
Yeah. Thank you, Brian. So look, it was clearly a mistake on my part. I shouldn't have done it. And it's just another note that we have to be vigilant. The rules are there to keep us all healthy. I will say this, had I attended the protest and been there for an hour or two, certainly I would have worn a mask. I am extremely careful, wearing masks, washing my hands, social distancing. The fact that I didn't in that split second is just an indication of I felt it was kind of an emergency. When I got the call to get down there, I just flew down the hill to do my part to escalate a tense situation. So not an excuse, to be sure. We all need to follow the rules, myself included, and I intend to do that. But in that moment of urgency, I forgot, and no excuse.
To follow up on that, Governor, the word seemed to be going around that you might make an appearance, and it seemed like nobody who was with you had a mask. And shouldn't it be on you at all times?
Yeah, no, it's true. I shouldn't laugh. It wasn't planned. I didn't go to the protest, even though I was hugely supportive, because, as I said, it was in direct conflict with the social distance. The gathering limit is still 15. Right? That's the rule that everyone should be following, including myself. I have been following. But I have to say, like that day, people worked so hard, the protest organizers included, to make that be an effective, peaceful demonstration. And at that moment, I guess like about 9 o'clock, when the colonel and the general called me and suggested that maybe my presence could play a role in de-escalating, I just answered the call and got down there as fast as I could. So it wasn't, and I was only there for a few minutes, right? I was just there long enough to try to play a role in keeping a lid on what could have been a tense situation. So the answer is yes, I should have. I didn't. It's a lesson learned, and it's a note that we can all be better.
Governor, there's a couple from Cranston that has spent the better part of the last 2 years planning a wedding on Block Island. Challenging in normal times, so they've been following your directives as things have evolved. Their event planner, who they've been working with, contacted DDR with a plan, with Department of Health. They both checked off, said everything's fine.
Okay, good.
For some reason, it went to Commerce. Commerce said you can't do this. And the reason was because it was interpreted as a gathering, as opposed to what restaurants can do. Now, this couple has made concessions. Mm-hmm. They got rid of the open bar. They have 100 people coming. It's on an 8-acre property, you can imagine. Yeah. They're all spread out, tables of 10 to 15. And Commerce calls it a gathering.
Yeah.
So
given do you know when
what
it is?
Happened, I'm sorry?
Do you know when it is?
The date is July 4th. I'd be happy to provide you the July 4th.
Okay, so listen, yes, happy, get me the information. This is a super tough call. Here's the deal with weddings. If it's in a place of worship, then you abide by the 25% occupancy in that place of worship. Beyond that, if it's in this phase 2, we have tried to say that events have to abide by the number 15 for social gatherings. And then in July, we're going to expand that, and I hope to be out, I can't remember if it's this Friday or next Monday, that I'll be providing more guidance. So if the short answer to these people is they're probably going to be able to go through with it because it's in July. If it were in June, then we are asking people to continue to abide by the 15.
Planning your own wedding. You can't say maybe.
Yeah.
People have booked hotel rooms 2 years ago. The groom's father lives in Florida.
Yeah.
He needs an answer now. So I have a couple of questions. And then they look at what happened across the street. 10,000 people. These people are trying to do everything by the book. Mm-hmm. So why can't you, in that setting? So then the other question is, why is Commerce even involved in this?
Yes,
when
so this,
DVR and DOH, which is calling the shots, approved it, and then they got, and so if it's not my coming to you, and this affects a lot of people on Block Island, Newport, they're all looking at this case to say, what do we do?
Yeah, so first of all, you make a very fair point. Second of all, I will give clearer guidance later this week on weddings, because you're right. I don't feel comfortable getting into the middle of this. It sounds like it was a mistake. Well, I'll get to them then. I don't know what happened. All I can tell you is what I've already said. In phase 2, social gatherings are limited to 15. If it's a wedding in a church, it can be 25%. Yeah, I don't know, Bill.
But why would Commerce be involved?
Because that's their job. You know, Commerce, it's clear that there's some miscommunication in this, and I'll own that. These people are working very hard and fast. There's thousands of different scenarios. It's not an excuse. But Commerce is the one that is DBR reports to Commerce.
What about the Department of Health? They're running the show here. Yeah. When I asked months ago about DOH versus on the high school graduations, who's calling the shots, RIDE or the Department of Health? You were following guidelines from the Department of Health.
Yes, we are. And those guidelines are online on reopeningri.com. What you are highlighting is clearly a miscommunication and something we have to address.
Governor,
so I'll get to those people today.
Thank you.
Not a coronavirus question, but related to the protest that you attended on Friday. Many people were calling to defund police. The Minneapolis City Council is now saying that's something that they're considering in their city. Would you support a local city or town if they decided to defund their local police department here?
First, let me say that would, of course, be up to the city and town, and I don't want to overreach into what any city or town wants to do. If you were to ask me the same question about the state police, I would say no. No, I don't think that's the right answer. I think clearly we have a lot more work to do to stamp out fully, completely racism, racial profiling, police brutality in all of its forms. And I think that, and we have to get to the business of continuing to do that. And there's no one thing. I don't think defunding is the answer. I think it's better training, nonviolence training, a more diverse leadership and that strategy for recruiting diversity. You know, one thing which I support, body cameras, that actually takes more money. So I don't think it's an answer to, I don't think the answer is defunding. And I don't think the data would suggest that fewer cops leads to greater safety. Having said that, I'm not saying everything's perfect. I think we have to look at some of the other things I've said.
Well, Governor, when the proposal is to defund the police, that's something of a slogan, not really intended literally. The idea, as proposed, as I understand it anyway, is that we often call upon the police to do things that are not effectively done by the police. To give a simple example, we have the war on drugs. where we've taken what one could say is a medical problem and criminalized it. So we treat, say, addiction to opioids very differently than we treat, say, addiction to alcohol. And the idea here is that the money we've been spending on that, because to send somebody to prison costs more than to send them to an Ivy League college. So the idea is that the money we've been spending on those kinds of things, the police, the courts, the criminal justice system, all of it, are effectively spent very inefficiently in those kinds of areas.
Now that I support. You know, last year I put before the legislature a proposal, which they chose not to move on, which was reducing the size of the ACI. A couple of years ago, I put forth sweeping legislation to change probation and parole to make it fairer. I absolutely think we need more resources to help formerly incarcerated people get jobs, job coaches, job training, education. You know, some of the other things that you're saying, that I support completely. But the question that was posed to me was defunding, and that I don't support.
So would you be willing to move some of the funds that are currently going to police into the health services to help people? I mean, right, because that would be what it was, reallocation of resources from the police to health for things like drugs or other types of interventions.
I'm not, look, I would support greater funding of those areas, right? So greater funding for affordable housing, greater funding for job training and education. You mentioned the opioid. You know, one of the most successful initiatives that we have, we call the HOPE initiative. It's with state police, where if you're found to have overdosed, they don't put you in jail. They help get you to a hospital. They help get you to a doctor. I think the first governor in America that did medical assisted treatment of folks who are addicted while they are in prison. So I am absolutely in favor of pushing. I would love to have the legislature's support on my proposal to reduce funding for our prisons and to reallocate that to training for people in the prison or healthcare or more medical assisted treatment. So yes.
Governor, I was there Friday night, and you and the first gentleman did de-escalate the situation without question. But I don't know if we do a service by giving this impression everyone it was a peaceful rally. I saw you speak Thursday with the clergy. That was a peaceful rally. I was there. There were people screaming vulgarity at the police and the National Guard. There were vulgar signs. An officer was assaulted, 9 people arrested, and what seems to be left out is, had you and the first gentleman not showed up, there were people ready to clash with the guard. Can we agree this term of peaceful protest, had your presence not come, who knows how long that would have gone or how that would have ended up?
Yeah. I appreciate you saying that. I think really the credit goes to the folks who organized it and the state police and National Guard and the leadership, but you're not incorrect. Look, there were 10,000 people there for hours, and that was very peaceful. You know, for hours, it was beautiful. It was a peaceful, everyone had their mask on. They were peaceful for hours, 10,000 people taking a stand. Later in the evening, and I unfortunately, or whatever, I chose to opt out of that because of my own public health guidance. You're correct, though, that as the hours went on, I think, 9,000 people went home. The organizer, God bless her, young woman, got up there and said, we've had a great rally, we've had a great protest, it's time to go home. And most people went home. Later in the evening, though, it was a very different scene. You're correct. It was a much more tense, angry, potentially violent. Yeah. There were definitely some agitators there who were stirring up the crowd. And that's the only reason I showed up, because I was after all the great work that went into making that peaceful, I was going to do anything I could to keep the peace. And maybe I play a small role in that. And if I did, I'm happy I did it.
Do you make the first gentleman wear that shirt?
I do not. Stop it.
On a serious note, we've learned now the FBI is looking into last Monday night. What can you tell us about that?
Yes, that is true. We are working every single day with federal authorities to try to figure out who did it and hold them accountable. We still don't know exactly who did it. but man, we're going to work as hard as we can. Yeah, oh yeah, yes, yeah, we're working with the FBI, we're working with our Attorney General, state police, we're collaborating with other state police and Attorney General and the U.S. Attorney. Absolutely. We've made a handful of arrests. We're going to continue to make arrests the more that we learn. But we don't know yet exactly who did it.
Just one more thing. People that were there told me, all seriousness, the first gentleman was soothing, calm. What did he say to you? That's we've got to know him from being. What did he say to you when the two of you walked out of there?
So it really wasn't planned at all. I got the call and they said, Gov, if you come down, we think it could help. So I ran out the door, and they said, but you got to come now. So I flew out the door and Andy just followed me. I think he was afraid. It was not a comfortable moment.
But I meant on the way home. Did he say anything like you owe me or anything?
Oh, no, we didn't really talk on the way home. We were shaken up by the whole thing. He probably thinks I'm a little crazy, but he knew that when he married me.
Oh.
Governor, some people are pointing out, if you can have testing for thousands of people who went to protests,
Yeah.
why not, if somebody wants to have a wedding later this summer or something like that, it could be allowed if they can go get testing after?
Okay, I'm glad you asked that question. So let me say a few things. Just because you get tested doesn't make you immune from the disease. Please make that point. If you get tested and you find out you're sick, you go into isolation, you prevent someone else from getting sick. But it is not it doesn't mean you're forever immune. You still have to wash your hands, stay 6 feet away, and the whole thing. I've always been a little bit reluctant, actually, to provide so much testing because it gives people a false sense of security. Look, I hear people being frustrated. If they can do that, why can't I do this? The protests were in clear violation of the gathering. Having said that, I'm not sure what the alternative was. I was the direction that I gave to the Guard and the state police was de-escalate, de-escalate, de-escalate. We didn't want violence. We didn't want to have to hold people back. So I don't think it's equivalent to compare a wedding to this protest at a moment of national unrest. These rules stink. It stinks. Like, to answer Bill, like if I were a bride, it would be frustrating. It stinks for us, my kids, everybody. It's frustrating. But look, we're in a good place because we followed the rules.
You said yourself that we're not seeing a spike in cases associated with some of the larger gatherings on Memorial Day. What does it mean, and maybe this is a better question for Dr. Alexander Scott, what will it mean if in 2 weeks from Friday, we are not seeing a massive spike in cases associated with these thousands of people having gathered?
It's something that we are concerned about, but as has been mentioned, we were pleased with our staff being there and the folks who peacefully participated. There was a high coverage of wearing facial coverings of some sort. And so if there is not a spike, it will be reassuring that it works. When you wear a mask, when you wear a cloth face covering, do your best to stay 6 feet apart. It was definitely challenging, but also have access to hand sanitizer, stay within small groups where you can, don't overmingle with multiple different sets of people. That can make a difference. And that's what we believe we are seeing as part of why there is an increase as of yet. It requires us to continue to watch, to continue to be vigilant, but it is encouraging for people to know that when you wear your masks, when you follow these rules, it works. And there's always that risk profile. If you let up on certain things, there's going to be more of a risk. But we can say, and our team was there making sure everyone who didn't had masks, we offered it to law enforcement too, where we could, that the overwhelming number of peaceful participants had masks on. And so we are hopeful that it will help in minimizing the types of spikes that are possible to occur across the country.
But doctor, wouldn't the likelihood of an outbreak resulting from the demonstrations be in significant part a consequence of whatever the prevalence is in the population, which we don't know and have been trying to measure. I mean, Trevor Bedford, the epidemiologist, just published an analysis over the weekend that's getting a lot of attention, where he figured that there might be about 3,000 additional infections nationally as a result of these demonstrations. In that case, he referred to it as the back of the envelope calculation, but he's assuming that the prevalence is probably about 0.5%, very low in terms of the general population, obviously much higher in some areas than others. But if that's the case, then the probability of a significant outbreak as a result of the demonstration would also be rather low. Of course, he's also making the observation that the reason we would have low prevalence like that is because of the effectiveness of, say, the governor's stay-at-home order issued very early in this process. But we can't know where that's going to go. I don't think.
So there are a number of things that you just asked. What I shared with Kim is one of the elements that we are hopeful will make a difference. We know that wearing some form of cloth face covering, particularly when you're in close contact for a period of time, works. And we want to make sure that that message is still there. Certainly it is encouraging that, as the governor has shared, we have 3% positivity noted with expanded testing. That helps relay that we are doing the job needed to identify people who have symptoms and are diagnosed with or identified as having COVID-19, getting them into isolation and getting their contacts quarantined. That is encouraging for saying that what occurred also is a part of hopefully not having as much of a spike because we know 3% were tested. That being said, we do know what we are seeing in certain communities throughout the state where there is more density amongst the population. And what we saw over the weekend was the definition of a more dense population. So we definitely need to be vigilant. We definitely want to make sure that people continue to wear cloth face coverings because it does make a difference. And now we're among the first states that is offering testing for people who have attended so that, as the governor mentioned, it is one point in time so that we can identify the people who are positive, get them isolated, and get their quarantines contacted. We want to emphasize that it's not, if you had a negative result, that's going to be true for all of us, we still need to be just as vigilant because the test does not work as well in people who do not have symptoms. So it's really only helpful in this targeted situation as a part of our overall strategy for identifying those who are positive so that we can do what's needed to stop transmission.
Thank you.